Mr. Doggett, you recognized.
Thank you very much. Thanks to each of our witnesses. Ms. Reichert, we have that same problem with our community pharmacies vanishing all over Texas. I just have to say that while I'm pleased that there have been some legislative steps, if we have 15 million Americans, which is about to happen, lose their way of financing access for health care, it will not be only the physicians who are not getting patients in, but it will be our pharmacies that will have many patients that want to be able to pay for a prescription but can't do it. And Mr. Connell, you mentioned a number of people for whom the end of Affordable Care Act tax credit, increased enhanced ones, will be catastrophic. Are each of those individuals you mentioned from across the country people that have blood cancer or have someone in their family in that condition?
Yes, the folks I mentioned run the gamut of folks that have people that have conditions in their family. Some of the folks that I mentioned by name are blood cancer patients, are caregivers for people with blood cancer. Kenny, I know from North Carolina, is a blood cancer patient.
What will happen to those individuals you mentioned who are not just numbers, but real people that have been in contact with you that are afflicted with conditions that all of us would dread to have for ourselves or a family member? What will happen if instead of the Affordable Care Act, we do what President Trump said and just give them a couple $1,000s and tell them to fend for themselves?
Well, let's look at what we would replace if we decide to scrap those tax credits. We right now, when consumers go to the marketplace, they are shopping for whatever plan works best for them, and they have essentially a discount code to lower the upfront cost of that, so that the amount that they pay is lowered kind of at that choice, at that selection. If we scrap that system and we replace it with one that forces patients to buy plans with higher deductibles, much higher out-of-pocket costs, out-of-pocket limits for the year, even if we do set aside a few $1,000s, even several $1,000s to fund an HSA, we're just shifting more costs to the consumers. And we've seen it again and again that when we do shift those costs to patients, they get stuck with more bills. They cut back on all their care, not just unnecessary care. They cut back on all their care, and people with blood cancer obviously can't afford to do that. And meanwhile, some people might be better off in terms of their finances. Thousands of dollars sent into a bank account with your name on it can be beneficial, and unfortunately, after age 65, folks could be able to take that out of the bank and use it for boats or a trip to Bali and instead of health care. We want folks to be using the taxpayer dollars today to get the health care they need today. We really can't afford to have that happen with HSAs.
I noticed a tweet from Mark Cuban, of all people, saying it is really, really dumb because when you give it to insurance carriers under the Affordable Care Act, they have to spend at least 85% of it on care for plan holders. When sent to people's HSAs, there's no assurance that the money will be spent on healthcare costs at all. So if they are fortunate and they don't have blood cancer or another dread disease and they just keep the money in the account, as you were referencing, they can take it out without any penalty at all at age 65, go on a vacation, buy a boat, do whatever they want to with it. And unlike other accounts of this nature that are tax-advantaged accounts, of course, they don't have to provide any verification at all. If I'm using a Flex account coming to your pharmacy, I've got to take and show the prescription I got in order to have the tax benefits. But under an HSA, you're triple tax benefits and no verification at all. One of the other HSA problems, of course, employer is only providing these high deductible plans. The individual involved has no incentive to have preventive care, to go see someone for something that may cost a few $100s when they don't have the money to do that. And with this high deductible plan, they have no help on that at all. And then another problem with HSAs that I hope to see corrected with the HSA Consumer Protection Act that I will be filing is the fact that if you're not able to make use of the account, any value provided by your employer or you put in can be consumed with junk fees by those who manage the HSAs month after month. So while they may have some value for some individuals, certainly as a tax shelter, as a substitute for the Affordable Care Act, they are no substitute. They are nothing care for the kind of folks you're talking about, and would really present the catastrophe you've described if we're unable to maintain the Affordable Care Act and try to substitute something of this meager nature. Thank you very much.